Sinclair Wilborn from Unity Health Harris Medical Center will join us. My friend, it's always a pleasure to get to see you. I haven't seen you in a while. How's things going?
It's going good. It's good to see you again.
Good to see you.
It has been too long, but it's awesome to be back actually in Newport. This is where I started my career.
Right.
So about 20 years ago, I started working in the prison system here and the mental health side. And that's actually how I got my start. And so it's really nice to come full circle and be here at Unity and here in the Newport community. So I'm really excited to be here with you.
Tell us a little bit, for those who might not know who you are, and tell us a little bit about you, your family, where you grew up, education-wise, so on and so forth.
Okay, so I'm Sinclair Winburn. I'm actually a therapist, a psychotherapist. Probably a little more psycho than therapist, but hey, that's
right too. I know you.
But I have a lot of fun. I like dealing with people. I like helping people, and I started my career doing a mixture of mental health and actually ministry within churches. Actually, was here in Emmanuel Baptist Church years ago with the church system, and then, like I said, worked in mental health in the prison, and. Actually, with that work, that's what got me into hospitals, was the experience that I had helping out in the prison system. Hospitals actually deal with a lot of difficult patients, and of course we had some pretty difficult ones in the prison system. So I ended up getting involved working with hospitals, and the one thing that we see now is that there are a lot of people that are having mental health problems. Anxiety and depression are at all-time highs, and people are just struggling. Life is difficult, and people need resources.
Sure.
And there's a lot of people that you and I, we have family, we have friends, we have people we go to. There's a lot of people who aren't as fortunate, and then they hit a point in their life where they need professional help. And so one of the exciting things is that here at Harris, we have opened a new adult psychiatric unit. It is a 12-bed unit, and it's designed to help people that are struggling with suicidal thoughts, severe depression and anxiety, other problems such as schizophrenia. And these issues, as you can see it on the news. It's just becoming more and more of an issue with our culture and society that it's been unaddressed for so long, and now the good thing is we're starting to deal with it, and we're taking that stigma off, because it's okay if you have mental health problems. It's no different than having a cold.
That's correct.
You go get it taken care of. Right. And so we have this resource here now that's great for the community. We've also started seeing people in outpatient with. We have a clinic across the street from the hospital called Clarity, where we have psychiatric residents that see patients and doing some therapy and medication management as well. So it doesn't have to be something so serious that you have to come to the hospital.
Right.
You can talk to folks out in the clinic across the street. So again, it's just really exciting what's going on here for the community.
Well, there's no doubt a tremendous need, as you say, and providing services that no doubt are needed. They're needed in all communities. Unity Health and Harris Medical Center has stepped up to the board and invested a lot of dollars for the facility itself, and then bringing in the professionals that we use for what we need. And you understand the commitment. I certainly understand the commitment. We want our community to understand the commitment that there's help there if you need it. Help there if you need it.
And there is absolutely no shame. One of the things that, like I said, it affects everyone. It's not just rich folks, poor folks. It affects everyone. And probably all of us have struggled with some depression or anxiety at some point. But I mean, we see anyone from, we see all ages that are struggling with it, all incomes. You see teachers, you see doctors, you see nurses, you see everybody. It runs the full gamut of folks in our society. And the good thing, like I said, is that stigma is starting to break, and people are starting to feel more comfortable saying, hey, I need to talk to someone.
You bet.
And that's a
What
great
made you, as a young man, when did you decide that this was the route that you might wanted to travel, and what made you decide that?
Well, I tell you, I wanted to be involved in helping people and making a difference. I knew that very early on. I can talk to anyone, and I'm not shy. I'm generally pretty good at listening, and so I wanted to make a difference, whether through the church, and I'm always involved in ministry with whatever church I'm affiliated with, and But I decided because I enjoyed that, I actually wanted to do it on a professional level and help people with their mental health as well. It's something that kind of comes naturally. I mean, it's a God-given, I would say, just aspect of who I am.
Sure.
Because whether I was doing, I'm more in administration right now.
Right.
I do deal a lot with crisis and such, but even on that front, it's how you treat people. I want to, wherever I'm at, I want to treat people with respect.
Absolutely.
Treat them decently, because that makes them better people. That helps our folks here at Harris Medical Center, employees. It helps them better treat the patients. And so it's really just about, I want to do good for people, and I want us to be good to others. That's what makes the difference. People don't go home from leaving the hospital and say, man, I'm so excited to be at the hospital. The hospital stinks. No one wants to be in the hospital.
That's exactly right.
But if you have that person that was good to you and treated you as if you mattered, you go home and you remember that, say, I didn't really want to be in the hospital, but that person said, hey, they took the time out of their day to make me feel like I mattered. And that is what it's about right there.
If someone is out there and think that they or somebody in their family might need some help, how do we go about getting with you guys to get some of that professional help?
Well, there's a couple different ways. I mean, one way that you can access is actually through the emergency room. If it's actually emergent, if you're to the point where you're having suicidal thoughts, or you're feeling anything that could be dangerous, don't take any chances. Call an ambulance, come to the ER, and one of our professionals is going to assess and try to help you out. You or your loved one, anyone needs any kind of assistance on an outpatient basis, wants to talk to a counselor, talk to a psychiatrist. We do have that available through the Clarity Clinic, and that covers Searcy or Newport.
Okay. And
so actually our folks in Searcy handle our scheduling, and that number is 501-203-0055.
Okay.
That's 501-203-0055. So that's a resource that is available for this community, and like I say, in Searcy as well. We also, besides accessing through the emergency room, we have primary care doctors as well, and they know how to access services. So don't hesitate to reach out to your primary care physician if you or your family member needs assistance.
Yeah, there is help there, and we want people to know that there's help here at Unity Health at Harris Medical Center, and there's no doubt if my good friend Sinclair is in charge right here, it's going to be a good program. There's no doubt about it, my friend.
Well, I appreciate the vote of confidence, and I'm definitely excited to be here. It's just, this is a great place, and it has come so far, and we just want to keep doing a better job taking care of our community. So thanks for having me.
Sinclair Wilborn, good to see you, my friend, and you keep doing good work here at Unity Health.
Thank you, sir.